Okay, that's fine. So let me just fill the screen with the presentation. Fine. So this is a paper with Marc Vothneck, who is now working.
1 second, Christophe, there is a video that is going to be shown shortly, and then you can start.
Okay, fine. So we'll start later.
Ladies and gentlemen, thank you for joining us today and welcome to our session, History, Gender, and Conflict. Without any further ado, please welcome our chair, Mr. ChristopheMuller, to open the session. Mr. ChristopheMuller, the screen is yours.
Thank you very much. So we are going to have 3 papers, or perhaps only 2, depending on if Priya is coming. So I suggest that we have each 20 minutes, 50 minutes of presentation, and then 5 minutes questions. The questions should come in through the chat. So we'll see if we are able to communicate easy enough. Let me start with my presentation. This is a paper with Marc Vothneck, who is working in Brussels at the European Commission. And that's a paper where we are interested in Indonesia. This is probably one of the many papers on Indonesia in this conference. We are interested in understanding what are the determinants of citizen participation into local activities, local community activities. In Indonesia, the community activities are extremely important. This is probably the most decentralized country in the world. So a lot of the economics, sociology, politics goes through these activities, as we'll see in a moment. And what we are trying to do is to use the fact that it's possible to observe a period of violence in various areas of Indonesia in a certain time, as we'll see, to reveal something about participation in these activities and about the ethnic component, the ethnic determinants of participation in these activities. So these community activities, this is a lot of the social capital which is there, and they are also useful because they can substitute the state or the market in situation when the markets or the state don't function very well, for example, in cases of violence. They can fill many different functions. They provide public goods and services. They can help people sharing risks. They can help people dealing with shocks or various externalities which are not treated by the state or by the market. They can help disseminating information across people, and they are also important for governance, that is for collective decisions. When I say community, I'm thinking about the village level in all parts of Indonesia, village or neighboring levels. One issue about the functioning of these activities is, of course, the free riding problem. Why is it that people get involved in this activity if it's taking them too much time, sometimes it's not just time, they have to work very hard in some of these groups, and even they have to provide some cash contribution in some of these groups. So why is it that it's working? And we are going to try to find a response to this issue by looking at the ethnic dimensions of these activities. There is one reason why these activities may not be working perfectly well, or at least the market or the state institution may not be working perfectly well, that is violent conflict. And it's already known for a long time in the literature that violence and violent conflict disrupt economic and social and political activities. It has been studied a lot in many contexts. What has not been studied so much is what happened with these community activities. To be able to study these communities activities, we need to move away from full war situation. If we look at full war, we would not be able to see anything because these activities would just not exist. So we need a context of moderate conflicts, and that's why Indonesia is particularly interesting for this. In the literature, there is a big literature on conflict. On the whole, everywhere, people have found that when you have conflict, it's bad for social life, for economics, for all the human activities in general, apart from the one who are fueling the conflict. But it has been also found that in many cases, the exposure to violence could increase civic engagement, particularly in terms of vote or political participation after the conflict. That's something which has been investigated in many countries, particularly in Africa. There's also literature on the dark side of social capital, where people have shown that when you have violence in some place, it generally makes people closer when these people are similar, when they come from the same ethnic group, for example, their ties are strengthened. And on the opposite, the links with other groups, other ethnic groups, other regions, other political groups are weakened by the conflict. This is something which has been found in also many contexts, and now we are getting more and more confident that this phenomenon happens all over the world. Right. There is also literature on group participation. What are the determinants of the participation in associations, in groups? And you find papers, top-level papers in the literature, particularly for the US, and people have emphasized the ethnic dimension again, but mostly the income dimension. They are looking at the inequality, the effect that what happens if you are in a poor neighborhood or in a rich neighborhood. Does it change something in terms of your contribution or of your participation into associations locally? And there is already some studies about the participation into religious groups, for example. I'm thinking about a paper by Chen in Journal of Political Economy. Another literature that we use is the literature on polarization on ethnic diversity, which is very much led by Esteban André, by the models by Esteban André on various application, including several papers by Renai Carroll. On these, researchers have found consistently that an index of polarization was often a good summary for trying to understand the ethnic tension locally, and the ethnic tensions which can be at the source of the conflict. That can be polarization along other lines than ethnic lines, but typically, ethnic tensions are important in many countries. So there are limits in this literature about conflicts on ethnicity, on local activities, or economic and social activities. The first one I explained is that when you study war, you can't have most of the local activities. You can't have health groups. You can't have groups of people dealing with the environment of the houses, trying to repair the roads or the public buildings. All these things that disappear. So that's an issue in this literature. You don't have enough studies with moderate violence to be able to see what happens. And this literature is mostly about political participation on new activities after a war, or subjective responses of people after an episode of violence. And there is a lot of qualitative evidence, which is fine, and we need more qualitative evidence, but on the other hand, there are very few quantitative papers on these issues. And when you have papers, econometric papers on these issues, the samples are small, non-representative, or they are only cross-sections, or experiment or opinion surveys, but they don't really focus on the actual choices that we are going to do using some panel data. Right. So we deal with these issues.
Professor, sorry to interrupt you.
Yeah.
Would you be wanting to share your slides? Or actually, someone asked in the chat also, like because your slide is not visible, your presentation. So would you be wanting?
See it?
No. So would you be? Yeah. So can you?
Okay. Let me see if I can do that.
Yeah. Thank you.
Because, so how can I do this? In the discussion?
Yeah, just shared the green share screen button.
The share screen is, this is what I've...
Yeah, but it's not visible.
It's not working?
No, I don't think.
Because on my side, it was working, and then I think we had we did some try before. So what can I do? It's not it was working before. What I can do is
now it's working. Now it's working. Yeah.
So it's working. The problem is when I use the full screen. Okay. That's the issue. So I'm going to avoid to use the full, and just, well, it's going to be a bit less easy to follow, but that's okay. So other problems of the literature are that, well, we don't understand why there is not this free rider problem, and our solution to this is to explore the ethnic relationship as explaining why there is not a free rider problem with the functioning of these associations. Typically, there is no causal analysis, only correlation, so we are going to have a causal approach. And also, the effect of violence is very much represented by one coefficient. There is an homogeneous impact of violence, and we are going to try to disaggregate this impact across local ethnic configuration. Okay. So I hope you can see what is happening. Okay. We're just looking at the chat. Okay, right. So the data that we use is the data on the Indonesian Family Life Survey, which is a very huge survey run in Indonesia for a long time, and you have many rounds of this survey. In two of these rounds, in 1997 and in 2000, we have information on the participation of the surveyed people into local activities. So that's the rounds that we used in this work, and the sample is quite large. We have more than 15,000 adult people in almost 200 communities. So that's one part of the data, and we match this data with data on conflict. There are many very interesting data sets on conflicts in Indonesia. The data that we use is data collected by UNSPHERE, United Nations data, which collect information on violent events from local and regional newspapers over a relatively long period from the 90s to 2003 for 14 provinces. And we have information on the emergence of violence, the incidence of violence, and also the number of fatalities. We need to aggregate this data at district level, because in this description from the newspaper, sometimes you just know that the event happened in a district. You don't know necessarily the exact location. And we have also excluded the center of Jakarta, because at that time, it was during the period of troubles. I say more about that. There were just no activities in the center of Jakarta. It was really too violent in this little place. But apart from that, that is fine. The kind of violence that we exploit here is violence by a group on another group, or possibly on an individual, or by the state on a group, or by a group, an ethnic group on the state. So it's a general definition of violence, but it doesn't include crime, for example. Okay. So if you want to see the data about violence, the blue line here shows the number of fatalities over time between 1990 to 2003, recorded in all these newspapers. And you can see that there is a period here with a surge in violence. This is the time after the financial crisis, after the fall of Suharto. It's called Reformasi, and it's a period where the police was not there, and there were some opportunity of violence which were seized by many people, including in fighting between ethnic groups. You can see on the top left here the small map of Indonesia with the area that we can cover by matching this violence data on the IFLS. So it's not all of Indonesia, but in fact it's, in terms of population, most of the population of Indonesia which is covered. That's the information that we have, and you can see here with different colors the district. You see that the district is something which is relatively large, and it goes from green to red depending on the number of fatalities. So there is some geographical dispersion, which should help us to estimate an econometric model. So the way we proceed is that we are going to look at propensity score to participate in activities within the activities that we have in this data. If you take a given activity, say a certain activity K, you can construct a score which would be a kind of latent propensity score, and you can have very simple models such as participation depend on the net expected benefit or people, or more complex models which would also be based on this kind of score. What is interesting for us is that in this score you can put a lot of information, preferably exogenous information, about the individuals themselves at the given time when they are observed, about the village at the time when they are observed, and perhaps some more fixed characteristics still about the village, the province, the area which is observed. You can include information on the conjuncture by having dummies for the years. You can have individual effects. This is the AI, which is going to help us to control for a huge quantity of fixed characteristics or characteristics which has not changed during the given period at the individual level. And finally, we have valence variable, and our main interest are these valence variables. These valence variables, I'll say more about that, and we are going to focus on the effect of this variable in models which are just discrete choice models. The individual I observed at the time t participates in activity k if it scores its net benefit from involvement is positive, and otherwise it doesn't participate. Right. So I'm mostly interested here in this kind of model in what is written at the bottom, the conflict indicators. The conflict indicators, they will be dummies for low on high violence. We are other specifications, but I don't have time to discuss them. Interaction of these dummies for low on high violence, in contrast with no violence at all. Interaction with polarization indices locally. Interaction of this interaction of the dummies with polarization with a third variable, which is the relative rate of participation of the own group in the activities, which is a way to capture the importance of the ethnic networks in the participation of these activities. The econometric is based on random effect logic. There is a literature which explains why with this data, which is unbalanced, this is a good idea to use this kind of estimators. There is a variety of endogeneity and selection and reflection effect issues which are to be dealt with econometric techniques. This is done first by looking at a large number of variants, introducing a large number of controls using a random effect, but also by instruments. On the instruments, they are based. What we instrument basically are local violence and the own group participation. And there are strategies which functions very well of instrumentation. The violence in a district is instrumented by the violence in neighboring district. There are several ways to do that. And the participation of the own group is instrumented by exogenous prediction of the mean participation of the own group, and also the group size, the size of the group in the village, which is an approach which has been developed by Lee for network and spatial models. And there is some way to generate instruments with the same ideas. And we have placebo tests and diagnostics, which work very well. So the economics works well. The standard error are computed with bootstrapped, and I can move very quickly to the results. So we have random effect logic. I have more recent results, but I won't have time to show them. So I'm showing the results which are a little bit old, but are still valid. In this result, we have plenty of explanations that I'm not going to discuss. On this explanation involve socio-demographics, different kind of needs, income, and they are very interesting, but we have no time for that. We have also the village effect. We are going to concentrate on ethnic polarization, on violence, and on the group. What you find is that ethnic polarization is indeed a factor very important for the participation. When you have a lot of polarization in a village, people participate more, especially in governance, social services, and cooperatives. Here are the 5 categories of groups to summarize the information activities. Governance groups, they are the ones who decide in the village. Social services, it's about education, it's about health for the kids often. Infrastructure, people repairing the roads or dealing or constructing some public buildings. Security groups, they range from neighborhood watch groups to local militia. And cooperatives, that's where the money is. So polarization pushes people to participate more in groups which are important politically or economically. When you have violence, you have a general reduction of the participation in almost all activities, except in places where you have ethnic polarization. In villages where you have ethnic polarization, what you find is that instead of decreasing the activities, this polarization, these ethnic tensions, they stimulate people to get engaged in the places that matter, that is, in governance, in the village council, for example, or in the cooperative, where is the money in the village, where are the economic interests. So this is one first result, which goes beyond what has been found in the literature, is that the polarization, in fact, can change the effect of violence, which is no longer depressing the activities, but stimulating them. And a second layer of effect is when you look at relative participation of the in-group. You can see, for example, here in this table, relative participation of the in-group encourage people to participate in activities. That is, if you have many people from your audience within one activity, you are more induced to. So it's possible to interact this variable of relative participation of your group with the phenomenon that we had seen before, which is the fact that when you have high intensity or low intensity of violence, but at least when you have local violence and high polarization, this is stimulating participation. And when you have, in addition, many people from your own group participating, then this is a further incentive to participate in this area. I'm going to stop, I think, about there, because we have little time, so I have many other results, which I won't have time to show. So just to conclude, we look at participation in community activities in the presence of violence between ethnic groups. And we find that the effect of violence is, in fact, heterogeneous and depend on the local ethnic configuration, which is something new. This is more detailed, more disaggregated than the studies which have been done in the literature. This is also causal studies, and we have a variety of results which I don't have time to comment, but the main result is that globally, when you have violence, it's depressing for the activities. When you have polarization, you don't see this depressing effect of violence, and sometimes you see even stimulation, and even more stimulation is when you have a strong engagement of your own ethnic group in an activity. Okay, so the violence in that sense reveals the networking responses of people in the village, and what we see is a complex interaction of socio-economic and ethnic solidarities in these villages. I have to stop myself, since I'm the head, if I want to keep some time for the other talks, or the only other talk, perhaps. I'm not sure whether I have time to answer the question. Let me stop the sharing. Let's see. Why is Central Jakarta not included? It's not included because that was so violent that there were no activities there anymore at that time. Is this model capable of controlling variable related to individual political preferences? Yes, if these preferences are stable, automatically they are accounted for within the individual effect. Okay, so let me stop the sharing of the screen so that Prashant perhaps can start his presentation.
Sure. Thank you so much, Professor. That was a great presentation. So I'll just share my screen.
So Priya, are you there? No, you're not there? Okay, so Prashant, you can go ahead and perhaps finish the session.
Sure. Professor, please, can you please let me know like when 5 minutes are left so that I can just start wrapping it up. Okay. Thank you. Okay, so hello everyone. I'm Prashant Poddar, and this is a joint book with my advisor, Dr. Somdeep Chatterjee at IIM Lucknow. So this paper is cited as Women's Empowerment and Intimate Partner Violence, Evidence from a Multidimensional Policy in India. So very briefly in this paper, we try to understand the impact of a multi-dimensional women empowerment policy on intimate partner violence faced by women. The existing evidence on the issue is extremely limited. And to the best of our knowledge, we try to provide one of the first evidences in this regard. So intimate partner violence is a fairly pervasive problem across the globe. WHO estimates suggest that about 1 in 3 women ever in a relationship have experienced some form of IPV in their lifetimes. However, there is considerable regional heterogeneity. So, for instance, the rate ranges from around 65% in Central Sub-Saharan Africa to around 20% in East Asia. This regional heterogeneity also exists in India, with the rates ranging from around 6% in Himachal Pradesh to around 59% in Bihar. Whereas the average incidence is around 33%, which is in line with the global estimates. So IPV is a major public health issue in its own regard. However, it can also lead to fatal and devastating health outcomes, ranging from severe disability to even death. Also, there is a considerable body of literature that shows that the incidence of IPV is associated with several other health problems such as mental and neurological disorders, substance abuse problems, sexual and reproductive health issues like low birth weight, pregnancy termination, as well as HIV contraction. And there have been many policy efforts which have aimed to reduce intimate partner violence faced by women. So for instance, there have been programs in the domain of conditional cash transfers, behavioral and awareness training programs, as well as innovative programs like edutainment and participatory theatre. And there's a lot of literature available on all these kinds of programs. And these programs have shown some promise in reducing IPV. However, in this paper, we try to understand whether women empowerment programs can help to reduce intimate partner violence faced by women. These empowerment programs typically focus on improving human capital investments or promote financial stability among women. So potentially they can narrow the gender gaps and thereby have an effect on intimate partner violence. Although women empowerment programs can help, empirical estimates on the impacts of such policies is extremely limited. And even within that limited evidence, the results are pretty mixed. So for instance, Green et al. 2015 do not find any impact of women empowerment programs on intimate partner violence, whereas Burt and Lensing 2019 find perverse consequences of empowerment programs on IPV. Also, even the evidence on multidimensional empowerment interventions is even more scarce. So these multidimensional interventions typically differ from traditional empowerment interventions in the sense that they provide simultaneous support across multiple dimensions to women. So for instance, in a traditional empowerment intervention, what would happen is women would be provided with, let's say, labor market opportunities or better educational opportunities. But in multidimensional empowerment interventions, support would be provided across several dimensions so as to kickstart the empowerment process. So in this context, Bendiera et al. 2019 have done a randomized multifaceted intervention and found that the program leads to lower sexual violence for women. So this paper targets the specific literature gap by studying a women empowerment program from India. The program that we focus on is called as SABLA, or Rajiv Gandhi Scheme for Empowerment of Adolescent Girls, which is a multifaceted policy support program launched in around late 2010. So the program was launched by the government of India to provide support to adolescent girls. And it actually is one of the largest programs of its kind and reaches 10 million adolescent girls annually in the age group of 11 to 18 years. The support is provided in the form of nutrition, health, education, and job training opportunities for eligible women. So the contribution of our paper is that, to the best of our knowledge, we provide one of the first evidence for the impact of a multi-dimensional women empowerment policy on incidence of IPV. So this is So we haven't really come across any existing literature where a government program that provides this multi-faceted support to women has been analyzed. So we try to provide some evidence in this regard. So the Sabla program essentially provides nutritional support or take-home ration to women. It also provides information on assessing public services, guidance on family welfare, reproductive and sexual health, as well as childcare practices to eligible women. It also provides skill training as well as vocational training. I've already talked about eligibility. Now, the policy was rolled out in 205 districts across India. Now, how these districts were selected was that all the districts in the country were ranked based on the score of a composite weighted index. This composite weighted index included 4 different criteria, which were dropout rates, literacy, age of marriage, and labor force participation of adolescents. And then these districts were categorized as good, moderate, and poor performing districts based on the score of the composite weighted index. Then few districts out of each category were selected for rolling out the program. However, we are not very sure whether these districts were randomly selected or not, since the government documents do not provide us many details about the same. However, like the map here shows, at least from the visual depiction, the districts look pretty spread out, but we can't make a claim regarding that since we do not have any specific information. I've already talked about the components of the program. I think the primary thing to notice here is that the Sabla program also differentiated in terms of program benefits between outer school girls as well as in-school girls. So for instance, iron, folic acid supplements, as well as vocational training were provided to outer school girls. However, these components were not provided to in-school girls. Also, there was a difference in frequency. So for instance, life skills education was provided 2 to 3 times per week to outer school girls, whereas it was provided 2 times per month to in-school girls. Now, coming on to the data, we use data from National Family Health Survey round 4, which was collected during 2015 and 16 to estimate our effects. It's basically an analogous of the DHS surveys which are conducted globally. It is known as National Family Health Survey in context of India. So the survey is nationally representative and covers over 600,000 households across the country. Since we are interested in understanding IPV, we focus on the ever married women in the domestic violence module of the survey, which essentially provides us information on the intimate partner violence questions. So our final sample size comes down to around 22,000 women in the age group of 15 to 28 years old. I will talk more about the age group in the upcoming sections of the identification strategy. We also use data from NFHS round 2 for providing support to our identification. You can also have a look at the survey questions. So we study emotional violence, sexual violence, as well as physical violence. We create 2 kinds of questions in order to measure intimate partner violence. The first variable is of the form faced emotional violence, which is a dummy taking value 1. If a woman answers if a woman answers in affirmative to any of these 3 questions. The second question is of the form emotional violence index, which is a continuous variable taking the value for the number of questions answered in affirmative. So if a woman answers the first 2 questions in affirmative, the emotional violence index variable will take the value 2. Similarly, we create variables for sexual violence, physical violence. We also aggregate all these questions and create variables for intimate partner violence in general. And coming on to our identification strategy, we simply can't compare Sabla districts to other districts because of potential endogenous selection. We are not sure whether these districts were randomly selected or not. We therefore exploit plausibly exogenous district cohort variation generated by the program features of Sabla. It's essentially a difference in difference design. So women in the age group of 15 to 22 years in our NFHS 4 survey were essentially eligible for Sabla for at least 1 year. I think this will be much more clear from the table here. So essentially what we are trying to do is we are trying to track the cohorts. A woman aged 11 in the policy year 2011 would be 15 in the survey year 2015. Now, since women aged 11 to 18 were eligible for program benefits, this tells us that women aged 15 to 22 were eligible for Sabla benefits for at least a year. So this makes women aged 15 to 22 in our NFHS survey as our exposed cohort. Now, women aged 23 and above would not be exposed to the program for even a single year. So we therefore take this cohort as the unexposed cohort. Women aged 23 to 28 as our unexposed cohort. Now, here I would like to mention that there's nothing particularly special about the upper bound of the unexposed cohort, that is 28. We simply take this value so as to keep our identification tight and also have enough observations in both the treatment as well as the control. So then we come, however, we do conduct some robustness checks in later sections to make sure that, this upper bound of the unexposed cohort is not biasing our results. So then we compare cohort-based differences in the outcomes of exposed and unexposed women in districts where the Sabla program was implemented to the districts where it was not. This table here provides a snapshot of our identification strategy. And we, as I mentioned before, the women aged 15 to 22 were eligible for the benefits under the Sabla program in the Sabla districts, whereas all the other combinations of districts as well as cohorts were not eligible for the program benefits. So then our specification looks something like this. We study the effect of being exposed to Sabla using an intent to treat analysis for individual I belonging to household H in district T. So here we have district fixed effects, age fixed effects, state by age fixed effects. Ever exposed here is a dummy taking value 1 for the exposed cohort. Sabla district is also a dummy taking value 1 for the districts where the program was enrolled. Beta 1 here is our coefficient of interest, which picks out the effect of the Sabla program. We also use robust standard errors clustered at the eligibility level, basically district into age level, since that was the level where the program was implemented. So then coming on to the results, we generally find that the program resulted in lower intimate partner violence for women who were potentially exposed to the Sabla program. We specifically find that women potentially exposed to the program face lesser emotional violence as well as lesser physical violence. Also, we have some suggestive evidence for lower intimate partner violence. Although we also find that women face lesser sexual violence, however, the estimates are not significant at conventional levels. The effect sizes here range from around 10% to 20%. Then we also try to check for parallel trends. However, an issue here is that ideally we would like to use an earlier round of NFHS, that is NFHS 3, to check for our parallel trends. However, NFHS 3 does not include district identifiers. So we choose a second best solution and use NFHS round 2, conducted in the late 1990s to check for parallel trends. And on the face of it, it seems that parallel trends assumption is met satisfactorily. We also conduct a falsification using an FHS2 dataset, and the results are pretty consistent. We also check for disaggregated measures for different forms of emotional, physical, and sexual violence, and find significant effects for different disaggregated questions as well. Then we also try to understand the effect of the program on husbands' controlling behavior. We actually find that women potentially exposed to the program, that husbands of women potentially exposed to the program, but now less likely to limit the contact of the women with her family. They were also more likely to trust women in matters related to money. For other questions as well, we find that the results are in a similar direction. However, they are not significant at conventional levels. So we have some suggestive evidence that perhaps husbands' control on women who are potentially exposed to the program now reduced. Then we also try to conduct a subsample analysis between rural and urban areas to see what's driving our results. Because there's plenty of literature that suggests that women in rural areas were more likely to face intimate partner violence because of a higher dependence on their family or their husbands for economical as well as social support. So we try to see whether rural areas or whether women in the rural areas or urban areas are likely to be the chief beneficiaries of the program. And we find that actually Sabla program had, like, our results were driven by women in the rural areas. This is actually also a positive indicator that women who were potentially lagging behind were likely to be the chief beneficiaries of the policy as compared to the women in the urban areas. Then we try to understand potential channels that might be, driving our results. So the first channel that we try to analyze is the effect of the program on anthropometric health outcomes of women. Now, the Sabla program provided take-home ration to women, and actually the nutritional component had costed the highest expenditure share for the program. So around 70 to 80% of the program expenses were made on the nutritional component itself. So and also literature suggests that women with better physical stature were likely to face less intimate partner violence. I think Ishwaran and Malhotra talk about it in their paper. So we tried to understand whether the Sabla program had any impact on anthropometric health outcomes of women. And we actually find that women potentially exposed to the program had higher height as well as higher weight when compared to women who were not exposed to the program. We also find evidence for higher BMI. However, again, the effects are not significant at conventional levels. Then we also try to see and understand the effect of the program on literacy as well as labor market effects. We find that women potentially exposed to the program were more likely to be literate as well as more likely to be employed when compared to women who were not exposed to the program. Again, now, so also we try to see whether whether these effect of the Sabla program on intimate partner violence is driven by reduced exposure effect or improvement in bargaining power, because we find that intimate partner violence goes down on account of let's say women being employed. So women being employed can reduce intimate partner violence if women now spend most of their time outside home, but it can also reduce intimate partner violence if women have improved bargaining power inside the household on account of their higher earnings. So we try to kind of get some idea that which is the probable channel that's driving our result. So we try to understand the effect of the program on women's say in earnings. We find that women's say in their own earnings actually improved on account of the program. So this tells us that women were now more likely to be employed and were also likely to have a higher say in their own earnings. We do not find any significant effect of the program on women's say in husbands' earnings. So this gives us some idea that potentially the improved bargaining power inside the household channel might be operating here instead of the exposure reduction effect. Then we also conduct several robustness checks to make sure that our results are not sensitive to alternative identification strategy or specifications. So for instance, we use an alternative identification strategy where we also account for years of exposure because we can potentially also track down the number of years a woman was exposed to the program. And we again find very similar results. Then we also try to check for underreporting of IP. So basically what can also happen is that the presence of a house member can lead a woman to misreport her the intimate partner violence faced by her. So we only take the subsample of interviews where the interview was not interrupted by any household member, such as an elder male or an elder female, and try to get our results. And we actually find very similar results compared to our original estimates. Then we also try to check for robustness of the age cohort. like we vary here the upper bound of the unexposed cohort and from 23 to 28. And again, we find very similar results and they do not change much. We also conduct a placebo test because it's possible that there is some trend in those particular districts or age groups that might be causing these effects for, for women. So we try to see the effect of the program on men who were not the beneficiaries of the program. And we do not find any impact on literacy and employment opportunities for these men who were not exposed to the policy. So then to conclude, we find evidence of positive effects of Sabla in reducing intimate partner violence. Both emotional and physical violence faced by married women reduced on account of the policy. Improved anthropometric outcomes, higher literacy, and better labor market opportunities serve as potential mechanisms for these effects. We also talk a bit about potential long-term impact of intimate partner violence when compared to CCT-based policies, because conditional cash transfer programs are likely to be one-shot in nature, whereas empowerment programs typically focus on improving the skill set of women, and thus are much more likely to be, long-term in nature, and hence can have a long-term impact on intimate partner violence. So we also talk a bit about it and talk about how empowerment programs can perhaps be a better solution moving forward in order to reduce intimate partner violence. So thank you very much. I'm happy to take the questions.
Thank you very much.
Thank you.
Well, you are perfectly on time. So I don't know if you want to answer some of the questions. Priya is still not there? I don't think so.
Yeah.
Can you see the question on the chat?
No, I can't.
Okay, let me
read
them for you. I can see several ones. First question. Do you have harder evidence than just subjective responses on partner violence? You know, the one issue with these surveys, that just people talk. They talk about events which are psychologically important for them. For people, the life of couple is complicated. Some of these people, they are frustrated. And you see that some of the questions, for example, have you ever been insulted? You know, if the person has lived 30 years with another one without ever receiving an insult, that would be. So there is some doubt about what in these questions, and sometimes in this survey you have record of physical violence, people going to the hospital and having an official record of violence.
Okay, so as far as I understand, so basically it's saying that that there is a psychological and subjective aspect to the answers of these questions. But again, if our identification strategy is working then the responses of different individuals in different cohorts and different districts should not vary differently. So they should not be very different from each other, like, because we are picking out the effect of Sabla program as an interaction of age cohort as well as district where the policy was implemented. So if our identification strategy works, the responses of the individual should not be very different in the beginning.
Imagine that a large components of the responses, they are psychological bias. People are nervous. Some people are more nervous than other ones. When they're followed perhaps by one of these support programs that helps to become calmer, and they are going to provide quite answers and say that they are suffering less from violence. So what you would observe an effect, but the problem is, what is this effect? This effect on what? Is it on the verbal statement, which, what is it, when you have a physical record or a clinical record of violence, this is control that this is really about violence. Another question was about, okay, you have an effect, but we would like to know what is happening. Okay, the fact that you have your two different parts of the sample and there is a gap between the violence in this part, that's fine. Let's accept that your statistical treatment is working. So now we would like to understand what's happening really. And you are trying to look at the characteristic, or in fact, they are the outcomes of the program.
Yeah.
But we would like to have more. For example, you suggested something about bargaining. Isn't that something that could help you to understand that, yes, this is the bargaining power is changing, but than just looking at the characteristic of people and using this characteristic yourself as saying this is a change in bargaining power. How would you know that the bargaining situation has changed? Is there a way to know that?
Yeah, so we try to, because since it's a reduced form exercise, it would be difficult to pin the channel like exactly, but we talk about several potential channels that might be working out here. So, and we conjecture that it's potentially a bargaining power story, because we find that women are now more likely to be employed and more likely to be educated. So we believe, since women are now more likely to be employed, and we also find evidence that women were more likely to, after the exposure to the program, women were now likely to have higher say in their own earnings.
But why is it a bargaining power? You can invent many other explanations based on this variable. For example, you could say, okay, if the women are busy, they are less exposed to opportunities of violence. So that would be another range of explanations.
I completely agree that exposure reduction can also be a potential channel. However, the issue here is that we do not have data about whether women are working outside the house or not in the survey. So the best that we could do at that point was that to test whether something related to bargaining power is changing or not, because we don't have data about exposure reduction. So that's what we tried as a second best solution. That's what we tried to do, and there we get some effects in terms of that women's say in their own earnings is improving. So potentially now they are working more or getting employed, and also their say is improving. So that's why we conjecture that potentially it's a improvement in bargaining power.
Thank you very much, Prashant.
Thank you very much for
that was very nice talking to you. I guess this is the end of the session. So thank you very much for everybody who is online and followed this session. I think I have to give the board back to the organizers, because I'm sure there are other sessions going on. Thank you.
Thank you.
Bye-bye.
Bye-bye.